Hello, beautiful souls. I'm Dr. Anna Schneider, and after over 15 years of helping patients break free from the shackles of back pain, I've got a secret to share. Your lower back isn't just a trouble spot, it's a messenger. Yes, that ache, that stiffness, that nagging discomfort, it's trying to tell you something deeper. Today, we're diving into the hidden nutritional culprits behind your back pain, and trust me, this isn't just science, it's your ticket to reclaiming your power, your strength, and your life. Picture this: you wake up without wincing, you move with ease, and you feel proud of the body carrying you through your day. That's not a dream, it's within your reach. As a doctor and your partner on this journey, I'm here to arm you with knowledge and fire you up to take control. We're talking vitamins, minerals, and a few surprises that could change everything. So, grab a cup of tea, get comfy, and let's unlock the mysteries of your lower back together. Oh, and stick around, I've got questions for you to spark some fun in the comments. Where are you watching from today? Let me know, city or country, I'd love to connect with you all. Let's start with a truth bomb. Back pain isn't just about, oh, I lifted something heavy or I'm getting older. Sure, those play a role, but after years in the clinic, I've seen too many patients stuck in a cycle, popping pills, stretching a bit, and hoping it goes away. Sound familiar? Here's the thing, your body is brilliant. That pain? It's a signal, not a life sentence. And often, it's screaming about what's missing inside, nutrients your spine, muscles, and bones are begging for. So, what's the first superstar we need to talk about? Vitamin D. Oh, this one's a game changer. If I had $1 for every patient I've helped by fixing their vitamin D levels, I'd be sipping tea on a yacht right now. Scientifically, vitamin D is a powerhouse anti-inflammatory. When you're low on it, your lower back often feels at first stiffness, soreness, even that deep ache that won't quit. Why? Because vitamin D is like the glue for your bones and muscles. Without it, inflammation creeps in, and your skeleton starts to whisper, "Help me." Think about this: in kids, a vitamin D deficiency can lead to bowed legs, scoliosis, or even soft bones, a condition called osteomalacia. In adults, it's subtler but just as serious: osteopenia, osteoporosis, or chronic pain that keeps you from living your fullest life. I've had patients come in, hunched over, thinking they're doomed, only to stand tall again after we boosted their D levels. You deserve that transformation too. Here's a quick tip: sunlight is your free vitamin D factory. 15 to 20 minutes a day can work wonders. But if you're stuck indoors or live where the sun forgets to shine, a supplement might be your new best friend. Aim for 2,000 to 5,000 IU daily with a meal. Fat helps it absorb. But don't just guess, get your levels checked. Have you ever had your vitamin D tested? Drop a yes or no in the comments, I'm curious. Now, let's not stop there. Vitamin D doesn't work alone, it's got a posse. Magnesium is its trusty sidekick. Without enough magnesium, your body struggles to use vitamin D properly. Ever feel like your back muscles are tight as a drum, cramping up no matter how much you stretch? That could be magnesium waving a red flag. It's essential for relaxing those muscles and keeping your spine happy. Then there's boron. Yes, boron. It's like the unsung hero of the mineral world. It boosts vitamin D staying power in your blood and fights inflammation. I've seen patients go from stiff and sore to flexible and free just by tweaking these three: vitamin D, magnesium, and boron. So, here's a question for you. Do you think your diet's giving you enough of these? Maybe you're a magnesium master or a boron beginner. Share your thoughts below. Okay, let's talk about calcium. It's not always the good guy we think it is. You've heard drink milk for strong bones, right? Well, too much calcium in the wrong places can turn your lower back into a battleground. Picture this: calcium deposits building up, forming bone spurs, arthritis, or even stenosis, where your spinal canal gets so narrow it pinches your nerves. Ouch. I've had patients come in with that deep, radiating pain, convinced surgery was their only option. But here's the hope: it doesn't have to be. Enter vitamin K2, your calcium traffic cop. This vitamin swoops in, grabs that rogue calcium from your soft tissues, and shuttles it back to your bones where it belongs. It's like a superhero keeping your spine clear and your joints smooth. Pair it with vitamin D, and you've got a dynamic duo. D builds the bones, K2 keeps them tidy. Here's the kicker, most people are low in K2. It's not in your typical multivitamin, and unless you're eating fermented foods like natto, yep, that funky Japanese soybean dish, or lots of grass-fed butter, you're probably missing out. I've seen miracles happen with a simple K2 supplement. 100 to 200 micrograms a day can start shifting things. Imagine saying goodbye to that grinding stiffness and hello to a spine that feels young again. Doesn't that fire you up? What's one food you love that might sneak some K2 into your life? Let's brainstorm in the comments. Now, I get it, pills and powders can feel overwhelming. But this isn't about perfection, it's about progress. Start small. Maybe add a K2-rich snack or swap one processed meal for something whole. You're not just feeding your body, you're honoring it. And trust me, after years of seeing patients light up when their pain fades, I know you've got this. Let's shift gears to your muscles, because a weak back isn't just about bones. If your lower back feels floppy or fatigued, like it can't hold you up, let's talk vitamin E. Not the cheap stuff you see everywhere, alpha-tocopherol alone won't cut it. I'm talking the real deal, the full vitamin E complex or tocotrienols. This is muscle rocket fuel. In my practice, I've done this trick. Someone comes in, barely able to bend, I give them a dose of wheat germ oil, and within minutes, their strength surges. Why? Vitamin E pumps oxygen into your muscles, fights atrophy, and keeps them resilient. Climbers use it to conquer mountains, you can use it to conquer your day. Think about it, as we age, muscle loss creeps in. Maybe you've noticed your back tires out faster. Vitamin E says, not on my watch. A little wheat germ oil, about a teaspoon a day, or a tocotrienol supplement can start rebuilding that power. Ever tried wheat germ oil? Tell me in the comments, I'm dying to hear your take. This isn't just about fixing pain, it's about reclaiming your strength. You're not frail, you're not fragile, you're a force. Every step you take to nourish your body is a victory. So, what's one activity you'd love to do pain-free? Dancing? Hiking? Chasing your kids? Let's dream big together below. Now, let's zoom into your discs, those cushy pads between your vertebrae. If they're wearing down, you might feel it as a deep, stubborn ache. Enter manganese, not to be confused with magnesium. This trace mineral is collagen's best friend, keeping your discs, ligaments, and tendons tough and flexible. Low manganese? You're risking disc issues, even scoliosis in extreme cases. I've seen patients with herniated discs turn things around by boosting manganese-rich foods, think leafy greens, nuts, or a pinch of whole grains. A supplement can help too, about 2 to 5 milligrams daily. But here's the catch, balance matters. Too many omega-6 fats from processed oils or sugary carbs can inflame everything, masking manganese's magic. So, swap that fried snack for some salmon or walnuts, your discs will thank you. What's your go-to healthy snack? Share it below, I might steal your idea. Here's where it gets real, not every ache is a vitamin fix. Kidney stones? Gallstones? Those can mimic back pain, hitting higher up with a gnawing sting. If your pain's spreading or feels off, check in with your doc. But for the everyday stuff, stiffness, weakness, that chronic nag, these nutrients are your toolkit. After all these years, I've learned one thing, your body's not the enemy. It's your ally, begging you to listen. So, start today. Test your vitamin D, sprinkle some magnesium, sip that wheat germ oil. You're not just healing, you're thriving. What's one step you'll take this week? Tell me, I'm rooting for you. There you have it, my friends, your lower back's SOS decoded. From vitamin D to manganese, you've got the keys to unlock a stronger, prouder you. I poured my heart into this because I believe in you. You're not defined by pain, you're defined by your power to rise above it. So, hit that like button if this sparked something in you, subscribe for more, and drop a comment. Where are you watching from? What's your biggest back pain win or struggle? Let's build this community together. I read every word. Until next time, keep shining, keep moving, and know I'm here cheering you on. This is Dr. Anna Schneider. See you soon.